into the Department of Disease. Seriously, do you know what Trump and RFK Jr. are doing about the measles outbreak? They are ripping away funding Congress already provided to respond to the outbreaks. They're stopping public health work in its tracks, even as this outbreak is threatening to spiral out of control. What are they doing about the opioid crisis, or maternal death rates, or bird flu for that matter? More cuts. And don't forget mass firings. What are they doing about vaccine hesitancy? Unsurprisingly, these anti-vaxxers are slashing vaccine research, and at the very same time dedicating resources to launch vaccine conspiracy investigations and resurrect debunked science. And now RFK Jr. announces he is pushing out some 20,000 workers at HHS. That is about as good for the public health as a cough in your face. Looking for new ways to make government more efficient and responsive is important. But Trump and RFK Jr. are doing anything but that. It does not take a genius to understand that pushing out 20,000 workers at a preeminent health agency, choking off funding for cancer research, and eliminating funding that prevents infectious diseases like measles will not make Americans healthier. It will just mean fewer health services for our communities, more opportunities for disease to spread, and longer waits for life-saving treatments and cures. These cuts will not reduce the deficit in any way, not at all. Instead, they threaten to incur massive costs down the road when we are caught flat-footed by the next healthcare crisis. Consider how much bipartisan spending Congress had to push out the door. Why? Because Trump failed to get the COVID pandemic under control when it first hit. It costs something to prevent pandemics, and it costs a whole lot more when we fail to stop them. An ounce of prevention is worth a pound of cure. But Trump and RFK Jr. are picking neither. They are picking chaos, plague, and pandemonium. That may as well be their official policy, because that is what is coming down the tracks if they don't change course. And I will tell you right now, when our health agencies are unprepared for a deadly pandemic, when our hospitals are overwhelmed with sick kids because our local public health officials can't track a worsening measles outbreak, when people start getting E. coli and we cannot figure out where it came from, or whooping cough starts spreading and we can't do basic tracing to stop it, or flu season sweeps through nursing homes like never before because no one bothered to help people get vaccinated, or a vaccine doesn't even exist because HHS stopped funding seasonal flu vaccine development, or our mental health centers close because federal grants were axed and opioid deaths rise again because prevention and treatment work was cut off. The American people will not forget it was Trump and RFK Jr. who gutted essential services and put their lives at risk. Today may be a great day for snake oil. It may be a great day for conspiracies. It may be a great day for measles, but it is an incredibly alarming day for America. It is an incredibly scary time for moms and dads who just want to keep their kids healthy and just want to know there are competent people on the job keeping us safe from diseases. I have warned my colleagues from the start, this is not some political game. The work that HH does, or in this case stops doing, has life and death consequences. Well, my colleagues better get used to hearing that warning, because for as long as Trump and RFK Jr. continue down this absolutely reckless path, I will echo that warning over and over and over again, because it is an important one. Given the stakes here, given the serious threats to our families, I don't say any of us can do anything less. We need to speak up about how dangerous this is. We are speaking up. We need to push back and fight for our families, and we need our families to stand up and fight with us. I know I will be, and I'm proud to be here with two of my great colleagues who feel the same. Tammy.
So yesterday, I was proud to lead a forum that shined a light on how Donald Trump is actively putting cures for cancer, Alzheimer's disease, and so many other illnesses further out of reach for American families. At that event yesterday, we heard from Dewey, a 10-year-old who shared with us what it's like watching his dad battle ALS. He needed our help so his dad, his hero, could live to watch him graduate from high school. Dewey begged us to protect the life-saving research being done at the NIH so his dad could see him walk across that stage and get his diploma. I say this because when we talk about staffing cuts at our nation's health department, we aren't just talking about some imaginary person sitting around pushing papers. We are talking about people who support life-saving research to find cures to ALS or Alzheimer's disease or cancer. And we're talking about giving hope to kids like Dewey. But today's announcement goes well beyond finding cures for serious illnesses. This announcement puts all of our health in jeopardy. We're talking about more kids getting sick from infectious diseases. We're talking about less support for seniors who rely on Medicaid and Medicare. We're even potentially talking about families getting sick from things that they buy at the grocery store. The Trump administration is endangering your family to make more room in their budget for tax breaks for billionaires and big corporations. They are rigging the system for themselves, and they want Americans to pay for it with their health and their lives. Look, I'm on board to make the health department more efficient, but here's where I differ. I want to make it more efficient for American families. I want to make it more efficient so that Americans can get better health care for a lower price. Donald Trump, RFK Jr., and Elon Musk want to gut the health department in service to themselves. Here's the simple truth. If Donald Trump and RFK Jr. were really interested in making Wisconsin families healthier, they'd join us in fighting to bring down the cost of prescription drugs and lower health care costs. And they are not doing that. Today's announcement, once again, shows that when they say make America healthy again, what they really mean is to make room in their budget for billionaire and corporate tax breaks. Senator Markey.
Thank you. And thank you to my two great colleagues for their incredible leadership on this issue. I'm Senator Ed Markey from Massachusetts. I'm the chairman of the ranking member on the Health Committee in the Health, Education, Labor, and Pensions Committee. And I want to thank Senators Patty Murray and Tammy Baldwin for their leadership on this issue. We are already in a health care crisis in the United States of America. Corporate greed is hollowing out nursing homes and hospitals. Hospitals, pharmacies, community health centers are struggling to keep their doors open. Health providers are burning out. Americans are waiting too long and paying too much for health care. Those are the problems we need to be tackling. Americans are asking for real solutions and demanding that we deliver. Instead, Robert F. Kennedy Jr. is using the Department of Health and Human Services to do the bidding of Elon Musk and Donald Trump rather than working on tackling the crisis that we're having in healthcare right now in our country. It is a Make America Sick Again agenda, which Robert F. Kennedy, Elon Musk, and Donald Trump are seeking to implement in our country. Let's look at what the agenda has been so far. Cut biomedical research grants, slowing down research into diabetes, Alzheimer's, cancer. Suddenly disrupting funding for community health centers. Spreading misinformation about the measles vaccine and pushing fringe conspiracy theories. Conspiring with Republicans to gut Medicaid, Social Security, food security benefits, and now fire 1/4 of the employees at the Department of Health and Human Services that have dedicated their lives to our public health. Today's announcement is not just a restructuring of the Department of Health and Human Services, it is a catastrophe for the health care of every American. Secretary Kennedy's actions to gut the Department of Health and Human Services will only leave Americans to get sicker while the rich get richer. When we cut off resources, we are leaving seniors, people struggling with mental illness and addiction, and people with disabilities as the first to lose the services. Disruptions in care will leave families stuck in chaos when they're just trying to get well. This administration will say this is about efficiency and cost saving. The only efficiency is efficiently cutting off health care for Americans who need it the most. The only cost saving is to enable tax breaks for millionaires and billionaires. Kennedy, Musk, and Trump only serve themselves and the wealthiest people in our country in order to drain the money from the healthcare systems in our nation for tax breaks for the wealthiest people in our society. No cuts to Medicaid, no cuts to life-saving research, no cuts to community health centers, hospitals, and pharmacies, no more cuts to healthcare, no more cuts. That is where we must be as a society. Donald Trump has hired Robert F. Kennedy Jr. to be the hitman on Medicaid, on NIH, on all of the funding that provides the security and the health for all Americans, and it's all for the tax rates for the millionaires and the billionaires. A vision without funding is an hallucination. And that's what they're trying to create and sell in our nation, that they're going to drain hundreds of billions of dollars out of all these healthcare programs and then pretend that America is healthier. Well, he and they are in for a fight, and Senator Murray is being a great leader in helping us to begin this conflict today. So thank you.
Thank you. Thank you very much, Senator. I'm happy to take some questions. Yes.
Is there any legislative remedy to this situation and layoffs, and we've seen some in the courts, but is there anything legislatively?
Well, I've been very clear that this administration has been illegally impounding dollars. That is illegal, and we are going to stay on them, and they've got to follow the law. We don't know exactly how these cuts are going to go. I think the president didn't even consult Congress. He had a report. He did a press conference with some Wall Street Journal or something. He didn't inform us. So we don't know the actual cuts or all of that. But what we do know is when you announce this many people will not be there to serve the critical interests of this agency, we know where the impact is. It's going to be in our families who are getting up and going to work and don't expect that their child might be exposed at wherever they went to school to some disease because it isn't being tracked anymore. Or when you get up and you watch a news thing that says that some lettuce is not safe, take it back. That won't be happening because you don't have people tracking it. Or making sure that people get access to Medicare or Medicaid or all the other services that are provided. That person, that human being is gone. It will impact every family in this country.
When we were talking about U.S. aid back when those cuts were announced, one of the issues you brought up was that it was illegal in that Elon Musk and Doge were not elected. They did not have the authority. Correct. In this case, it does seem to be agency down, starting with the secretary, that these decisions were made. Do you think that that distinction changes the situation and makes it different?
Well, I will leave that to attorneys, which I am not, but I do know the law, and the law is that Congress passes the funds and the administration enacts it, and they cannot illegally impound funds that Congress has appropriated.
Ma'am, you talked about the stakes of this and many of the other things that you're seeing from the Trump administration. We've seen a trend of a lot of Democrats using profanity in official communications. Senator Duckworth, yes, sorry.
The Ds.
Senator Duckworth sent out a press release yesterday calling Pete Hegseth an effing liar. Do you think that reflects, what you guys are seeing from the administration, the urgency, and do you think that that's an effective way to communicate that in some cases?
I'm not going to comment on people's language. I'm not here to be a censor of people's language. I am here to tell people in this country that I'm angry, and I'm watching an administration come in and change the course in life and health and well-being of people in my communities, and I'm fighting back.
We obviously just got the CR for the rest of this fiscal year, but at some point in the next few weeks or maybe a couple months, depending on timing, you will get the president's budget request for the upcoming fiscal year. And I'm curious how you think these department and agency actions combined with whatever we may see in that budget request are going to impact how you approach the next appropriations process, especially with labor age.
So critically, when we do our appropriations bills, we have the agency head come before us on a bipartisan way and get to ask them questions and get their responses and their answers about their budget request, what they're asking for, and then we make our evaluation as members of Congress. It is our job to say, no, you aren't putting enough money in food safety. You're not putting enough money in NIH, and we add or subtract according to that. So I'll be demanding that those secretaries come before our appropriations committees and explain to us. They talk about transparency and accountability. Well, come before our committees, be transparent, tell us what you're doing, and we as Congress, whose responsibility it is to allocate funding, will make a decision about whether or not we agree with that. Yeah.
Senator, I want to ask, you mentioned vaccine hesitancy is one of your concerns. You mentioned vaccine skepticism in your opening remarks. Do you have any reaction to the Washington Post report that while these jobs are being cut from HHS, Secretary has put David Geyer, a vaccine skeptic, in charge of examining links between autism and vaccination?
I am deeply concerned that this administration has consistently put in place people at critical agencies who are promoting vaccine hesitancy and promoting our ideas that have been shown time and time again through numerous scientific research are not true. And what does that do? It puts the health and safety of people in this country at risk. And as we heard when we had hearings for some of these, when we spend all this money that we have on retesting things and redoing things, we are not putting our money into research that can actually show us the answers for some of the questions that they're raising. So yeah, I'm deeply concerned.
And if I can ask a question on a separate topic, but it's a little related to the issue of funding. I saw this letter that you all sent to OMB regarding spending, and I'm curious what...
Are you talking about the letter that Susan Collins and I sent today? Okay.
I'm wondering what recourse you think you might have if you don't get a desirable response from the administration on what they're going to do with this funding and the spending.
Well, this isn't a question. It's a matter of law. Under law, bipartisan, Democrats and Republicans, as Senator Collins and I stated this, the president doesn't have a choice to pick and choose which parts of emergency spending he can allocate for. We are telling him, this is the law, allocate the funding.
A big theme of President Trump's administration so far has been sending stuff back to the state levels. Can you clarify what of these cuts can be picked up by the state level health agencies?
I can tell you this right now today, and it's only 1 o'clock in my state, we are getting panicked calls from our health agencies about what funding is going to get cut off. We are in the middle of flu season. We are in the middle of a measles outbreak as well as whooping cough. And these are the officials that are letting people know, here's where it's safe, here's where the outbreaks are, here's how you can protect ourselves. Are these offices going to be closed? Are people going to get the information? How are they going to decide? We're hearing that offices are going to close. So already our local and state and county officials are saying to us, oh my gosh, how are we going to do the jobs that people are counting us on? And I can tell you from my state and many other states, they don't have the budgets to all of a sudden go, oh, okay, excuse me, we'll just send a few more $1 million because Trump decided he's not going to do his federal obligation. They have to count on this funding, and to have it ripped away like this is just astounding to me. Yeah.
Do you have concerns that the impacts might be disproportionate, like regional versus urban communities, or some states versus other states?
I mean, I always have concerns. Often it's our rural communities who have the least amount of money to be able to do this kind of public health work that we are very seriously worried about losing. They are the folks that have the least amount of resources to be able to help out their constituents. They don't have the tax base, they don't have the manpower, they don't have all the infrastructure you need. So yeah, I'm very concerned about what this means for our rural communities.
Can I ask, are you worried about the impact of the cuts on tracking food safety concerns?
Absolutely. I mean, I'm always, Saturday morning, turn on the news and they say, oh, you know, don't buy lettuce from some grocery store because of this and check the dates. We all go to our refrigerator and check the dates. What if we have to get up on Saturday morning and go, nobody's checking that. I hope everything in my refrigerator is okay. I mean, that's what they're putting at risk.
If we've all gotten a question.
You get the last one.
Just, this is unrelated, but obviously big news about Ambassador nominee to the UN, Elise Stefanik being pulled back. Do you have any comment on that?
I don't have any insight into that, or why that's being done, or what she's going to do, or whether it's about vote counts or something else. I guess we'll all learn in the next news cycle. Thank you.
Thanks.